One of the highest and fastest vaccination rates in the world is allowing us at long last to let our hair down. It's been extraordinary, and the results have defied the modelling.
It seems that the modelling, in some respects, underestimated the impact of vaccines. We were still expecting a much higher hospitalisation rate than what we're seeing.
The magic word is decoupling. It occurs when cases go up, but hospitalisations and ICU admissions may not follow. And that's what we've achieved nationally.
At the start of August, we had maybe 3,000 active cases, and a week later, 400 of those people were in hospital, and about 65 of them were in ICU. So that was a hospitalisation rate of about 13% and an ICU rate of about 2%. If we fast forward to today, we have a hospitalisation rate of under 4%, 1,000 people in hospital, and our ICU rate is under 1%.
Israel has also seen decoupling due to vaccination, even in its large Delta outbreak over the northern summer.
We could see is that there was a rise in cases, but in terms of death, the number of deaths was much less. And we have also to say that most of the deaths, most of the severe cases were people that were not vaccinated.
But we do need to be wary of our current good fortune being only temporary. Israeli scientists believe that a significant reason for their recent fourth wave was waning vaccine immunity at around 5 or 6 months after the second dose, which is why they began a booster program for everyone over the age of 12, and as a result, bent their curve downwards.
So we really saw a change in the trend by September, and we can say that today in Israel we have only around a few hundreds of cases, and all, I would say, experts concur to say that this is thanks to the booster shot.
The situation is still fragile. We know that there's waning immunity. We're in a great position though in Australia because such a large number of our population have been vaccinated in just the last 8 weeks, allowing us to maintain immunity potentially through boosters for everyone. But yes, we are in a precarious position, which means we have to always maintain that balance between using the best science to inform our policy, vaccination and the public health measures, which we're going to have to juggle still over the coming months.
Are you allergic to anything?
For those who have double dose protection, data from overseas show that COVID is particularly breaking through among the elderly.
They're more likely to occur in people that make a poorer immune response to the vaccine, and that's in people who are immunosuppressed, the elderly. It's important to realise that even in breakthrough infections, the disease is much, much milder, and the risk of hospitalisation and or death is extremely small.
2 doses are fully vaccinated. The booster, I've said this before, it gives you a boost, and it's important for those that have got to that 6-month time to consider their booster.
The advice at the moment is that boosters are available for everyone aged over 18, 6 or more months after their second dose, but not essential.
And so basically what we believe in Israel is that 2 doses at least, when you look at the future, will not be enough to keep a level of effectiveness that is, I would say, adequate to protect the population. And therefore, we do believe that 3 doses should be the number, at least the number of doses.
ATAGI have said they'll review all this again in January 2022 and see what the uptake is. There'll be more evidence at that point. So at some stage, we may move to this being compulsory and included as your primary vaccination. But at the moment, I think optional is okay.
The problem, though, for some groups in Australia is that they haven't achieved decent rates of even 2 doses.
The first is our Indigenous communities. They have lower rates of vaccination across the board. Another key group are pregnant women. Pregnant women are probably getting vaccinated at about half the rate of women in general, and we can see that of the pregnant women who were cases of COVID, only about 6% of them had been vaccinated, compared with 15% of the general population. And another key area where we actually have very poor visibility in the data are people with disabilities who are living at home.
We've got to keep our eye on those groups, and we've got to tailor the vaccination messages and modes of delivery to those communities.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.